I'm going to let Dr. Miller go first to talk in a more umbrella approach about these four programs and what the opportunities are.
Sure, and I also want to just introduce George Phillips, who's on the call this morning with us. So he's over the pharmacy tech program at ECC. So I'm going to have George chime in when it's appropriate. But at Elgin Community College, and good morning, everyone. I wish I could see all your faces, but it's good to have you here today. At Elgin Community College, we have a health professions division, which includes lots of different options, all the way from nursing assistant to phlebotomy to dental assisting, which you heard about. We also have surgical technology, we have radiography, we have clinical lab technology, lots of different options. We also have a non-credit side of the college that offers some healthcare, and that's where the pharmacy technician program resides. So you're going to be hearing about a couple of these opportunities today. We've selected all certificate level programs that can be completed in 1 year or less. And I think with that, I'll be happy to maybe take the first question, Nancy.
Okay, any questions yet? Or we can keep going for a little bit and you keep putting questions in the chat box and we'll come back to them. So George, I would like to go to you next because in the pharmacy tech role, it is a little bit different than the programs that Wendy talked about under the nursing assistant and the dental assisting programs. Could you talk a little bit about that program and how it is part of the continuing ed area of the offerings, the healthcare offerings at ECC?
Sure thing, Nancy. Thank you so much for inviting me, and it's great to be here. I want to say I'm the director of the Continuing Education Department at ECC. We offer non-credit courses, all kinds, but including health certification type courses, things leading to employment, and also for those who want to see if a field is of interest to them. So we have a pharmacy technician course. It's a non-credit course. We offer it in partnership with one of our vendors, Condensed Curriculum International. We've offered the course from them for over 15 years. Hundreds of students have taken it. It prepares students to work in a pharmacy setting, whether that's retail or at a hospital or a pharmaceutical company. And it's also preparing students to pass the industry recognized pharmacy technician certification board certification exam. There's no prerequisites to take this course, but there are age limits as to who can be a pharmacy technician in Illinois. For example, all pharmacy technicians have to be registered with Illinois Department of Financial and Professional Regulation. They have to be at least 16 years old. So they can be in high school. They must submit proof that they are current high school students when they give an application to Illinois. Also, if they're not a high school student, they have to have evidence that they've graduated from a high school or have the high school equivalency, commonly known GED. I know it's HSC nowadays. Now, if you want to become a certified pharmacy technician, you have to be at least 18 years old. In that case, you have to submit proof to Illinois that you completed a training program, which is what our course does. And you have to pass an exam. And the most common one is offered by the Pharmacy Technician Certification Board. So the course prepares a student to pass that exam, gives them the best chance to do that. The course, traditionally, we've offered it in person, but given COVID and the pandemic, we now offer it online until we have a green light to go back and do it in person. The in-person course, it's about 52 hours, classroom hours. It can be completed, we offer it in spring and fall, usually like March in spring, and it goes like 2.5 months. And then fall will start up like October. So we're in the semesters. Tuition is $1,299 for the whole thing. Includes the books and any classroom materials or any ebooks. The exam is a separate fee. That's $129 from the certification board. There is an optional 80-hour externship available to students. It's at additional cost, but a student can then actually work at a pharmacy. And that's been has been very well received by students, because they say, now I've learned this, but where do I get a job, or where do I do it? Well, now we have these connections, so they can go to CVS or Costco or Walmart, and it's very convenient for them. Of course, when we get back to doing more things in person. There could be ECC scholarship funds available to pay the tuition, because there are continuing ed scholarship fund, and that's availability, but the financial department at ECC would know that. And then as far as how to register for the course, you can register and pay online through our CE continuing education webpage. Then you just choose healthcare, you choose the course pharmacy technician, and go right through all the prompts, and there you go. Right now, since the course is offered online at this time, our vendor has a version of it, and you can start it at any time. So we're not bound by certain dates, because in the online environment we're in. So anybody can do it now and just sign up and do it and start the course. It's self-paced, but there is support by the vendor. Normally, you can complete the online version. You have up to 6 months to complete it, but a lot of times, depending on someone's background and all that, it goes quicker than that. Probably the hardest part of the course is the mathematical part, the dosages and calculations. You get into the career considerations. A person would be detail oriented, because you have to be exact here. And also that idea of the math skills. I also think that talking about maybe the environment of the job, let's say wages, retail stores, maybe 12 to 15 an hour. You can make a little more money at the hospitals or maybe a pharmaceutical company. The hours are very flexible. When we talk to the pharmacies, the local ones, they say, well, gosh, I can hire anybody for night times, weekends. So this could be a very good part-time job for someone. Also, CVS and Costco have expressed that there's a big demand for English, Spanish employees in this area. So just say when you're bilingual, there's something you have a real advantage. And also the other thing with this course, it can also serve as an introduction to pursuing a career as a pharmacist, or maybe another health career. So again, you're getting immersed in the health sciences, health areas. That's the bird's eye view.
Perfect, George. We just got a great question. I'm gonna
Sure.
let you take this, and also possibly Dr. Miller. There's just a clarification question between what is credit and what is non-credit, and what is a certificate program versus a degree program. Could one of you address that, please?
Yeah. From my understanding, I'll just say that non-credit, you're not pursuing a degree. And you wouldn't have college credit for what a non-credit class is. So that's my thought. Now, Wendy, if you get a little more color to that, that'd be great.
No, George is spot on. Yes. So the credit side of the college is where students either earn a certificate, which is typically something that's less than a 2-year program. Okay, so a certificate could be 1 semester, which is, 16 weeks. It could be a 1-year certificate program. It could be a 3-semester certificate program. But as soon as students are looking at a degree, which ECC offers associate degrees. We have Associate of Applied Science degrees. We have Associate in Arts degrees, Associate in Science degrees. Those are all 2-year programs. And those often lead to transferring to a 4-year university to pursue, additional education and expanded opportunities.
And George, you just got another question concerning what age, and I think you mentioned that, but I wanted you to repeat it again. I think you mentioned they can start the work on pharmacy tech while they're still in high school, age 16, and then have the option for certification at 18. Could
That's
you
right.
correct me
Yeah.
if that's not right?
You're absolutely right. Thank you.
So guys, for those of you who are right now in high school, you could complete this program and come out working in the profession before you even graduated from high school. It'd be a great opportunity, and there's a huge need for them. I'm assuming, George, y'all are predicting significant growth.
Yes,
pharmacy tech
it is. And we've heard from the local pharmacies that there is a great opportunity. Yes.
One other thing you'll also see when you have continuing ed courses like pharmacy tech, a lot of times they are responding to the business needs of the area. And they're usually programs where you can train people quickly for new professions and get them in the job, because in most cases, there's usually a shortage in that area, and people are trying to get, the business community is trying to get students and workers placed as quickly as we can into those professions. So that kind of gives you an overview of pharmacy tech. We will come back to that if it's
Sure.
okay. Kim, Ms. Plate, let's talk about dental assisting.
Thank you so much. So
Uh-huh.
dental assisting is a credit certificate program. So it takes 3 full-time semesters to complete the dental assisting program. We do not have any prerequisites. We are accredited by the American Dental Association. So if you've heard of them, we meet there. We have very rigorous standards for education for dental assisting, and we have to meet the Commission on Dental Accreditation standards for dental assisting education. Maybe something else to think about, because our courses are credit courses, they count as electives towards an associate degree that Dr. Miller was talking about. So if you're thinking maybe even dental school, or our courses don't transfer to hygiene, but they would give you a good background for dental hygiene. Hygiene is an associate degree program that ECC does not offer. But because they're credit courses, you could be taking your associate degree and you're allowed to take what's called an elective, and dental assisting courses count as electives towards that associate degree. So if you have a dental interest, you're not sure, you're at ECC taking general education courses, take a dental assisting course or two and see if you like dentistry. And then you can then pursue dental assisting or something beyond that. And that would be completely up to you. Trying to think. Admission to dental assisting is a health professions application, obviously an application to the college, a health professions application. And currently we're doing what's called a PSB test. And that's just a health occupations aptitude test, but we're also looking at other avenues for that admission process. So that may change in the next year or so. Dental assistants, maybe I should clarify what they do.
Mm-hmm.
In a dental office, there's typically 3 people in the office: the dental assistant, the dental hygienist, and the dentist. The dental assistant is the one that's assisting the doctor, helping with filling procedures, taking x-rays, taking impressions. Oftentimes they're working at the front desk. The dental hygienist is the one that cleans your teeth. So if you go in and get your teeth cleaned and then doctor comes in and does their exam, you had your teeth cleaned by a dental hygienist. The assistants are the other ones working in the office. As far as job opportunities, there's a ton of jobs out there for dental assistants right now. I'm on a job list for like a radius of 50 miles, and there's new postings every day. There's 50, 100 jobs there. And if you look at the Bureau of Labor Statistics on their government website, it's a very high growth career for this country. And then when you finish our program, because we're accredited, you can sit for our national examination, the Dental Assisting National Board, to become a certified dental assistant. So that's certification. The college is a training program. So to be a certified dental assistant is a national examination.
Great. Ms. Plate, we have a question, and this is the perfect question for you. How long have you been doing this?
Oh, I don't know if
A
I want to
little bit
answer
about your
that.
history.
Several decades. I graduated from Larkin. I went to ECC on my bicycle because my parents did not let me have my driver's license until I was 18. So I rode my bike to the college to register. I took a year of general studies because I didn't know what the heck I wanted to be when I grew up. And I found dental assisting in the course catalog, and it sounded interesting to me. I had thought I always wanted to be a nurse. And then as I got older, I realized that maybe nursing wasn't for me. A little too gory, maybe a little too personal in other people's personal spaces. And so I took one dental assisting course, loved it, completed the program. I worked in an office in Elgin for over 20 years, so that gives you some clue how long ago that was. And then I came to the college as part-time faculty in the program. When my program director retired, I took over for her, thinking this was my next job growth as a professional. And I've been the program director now for about 15 years, maybe. So I've been in the area for quite a while. And actually, I still work as a
Well, that was
chairside
gonna be my
assistant.
question. Yeah.
Yep. I still work as a chairside assistant 1 night a week in an office in the area because I love the work so much.
You got another question. Is there an age requirement for the dental assisting program, and do you have to be done with high school to start?
Unfortunately, you do, or an equivalency. That's part of our accreditation with the American Dental Association. They're the ones that drive that. That accreditation piece is really important. We're one of only 5 accredited programs in the state of Illinois. We're the only one north of Interstate 80. And so there are very rigorous standards for the education. The American Dental Association Commission on Dental Accreditation, every year and every 7 years, they come physically to the campus, but they're looking at our curriculum, our facilities, our faculty, what we're doing, how we're teaching it, how we're assessing it. And so it's very rigorous, and you do have to be 18 years or older. And part of that is because we teach how to take dental x-rays, and radiography requires that 18 year of age requirement also.
Great. But let's just walk through that. If you happen to be a senior today on this call and you're graduating in May, I'm assuming, Kim, that they could enroll in dental assisting by August.
Yes, they could, definitely.
Okay. So it's not a long time. If you're not, and even if you're a junior, if you're planning in that direction, we can get you more contact with Kim and with other people that actually work in the profession, so you can talk to people that actually do the job every day.
One more thing too, we do have 2 general education courses as part of our curriculum. They're not prerequisites, but they're required to finish our certificate, an English 101 and a speech 101. So if you wanted to get ahead on that, you could take those over the summer.
That's great. Thank you so much.
You're welcome.
Let's jump now. I know we had several students that were interested in the nursing assistant and the nursing program. So I'm going to turn it over to Mrs. Grossbach to give us a background in those 2 programs. Renee, can you talk about the nursing assistant program? Some of the students that are on this call very likely may be in the nursing assistant program at Larkin. So I just wanted to reference that too. If you can talk a little bit about that program, and also about the nursing program at ECC, the associate degree program.
Sure, absolutely. Good morning, everyone. First, I'll just start in case there's anyone that's on the call that's just not sure what a certified nursing assistant is or what they do. They do work under the supervision of a registered nurse, an RN, or a licensed practical nurse, an LPN. They can work with patients of all ages, of all abilities. It just varies depending on what your employment site is. Most certified nursing assistants, though, do work in long-term care centers, like a nursing home setting, or at a person's residence, so through home health. As far as our program at ECC, we have a basic nurse assistant training program. This is a certificate program. So it's a 1 semester course. So it's actually 7 credits, 1 semester course. When you successfully complete the course, then you will receive a basic vocational specialist certificate in the basic nurse assistant training program. I know that's a mouthful. Our program at the college is accredited by the Illinois Department of Public Health, IDPH. As far as what do you do when you're in this 1 semester course? Well, your course is going to include lecture time. So it's about when we're back face to face, it's about 80 hours of lecture, but then you're also practicing your skills in our campus lab, which is set up just like a hospital. So that's where you have your actual lecture time and your lab time. So we have the room set up with 10 hospital beds. So it's just like you're walking right into a hospital setting. So it's really nice to be able to get your training right in that type of facility. So you'll have some time there that you'll be practicing your lab skills and getting ready to go do clinicals. So our clinicals are off campus, where you actually now put some of those skills that you've been practicing in the campus lab, you'll put them to work, and you'll actually work with patients. And so we have clinicals in hospitals. So because of COVID, we have not been able to get back into our long-term care centers, our nursing homes. Typically, that's where our clinicals are. Places like Friendship Village in Schaumburg, Greenfields in Geneva. But because of COVID, we're not able to get in those facilities. I'm hoping in fall we'll be back. Right now, our clinicals are taking place at Advocate Sherman. So I have students that actually started yesterday for their clinicals. So they'll be doing 6 weeks of clinical. So it's about 40 hours of clinical. And then I have another group that will be starting this week, and they're going to Amita St. Joe's in Elgin to do their clinicals for the next 6 weeks. As far as getting into the program, Kim mentioned for the dental assisting program, she mentioned a PSB exam. So for this program, we currently have that exam as a requirement, but just like Kim said, we're also looking at, possibly other means. But for right now, if you were to register and take this class in fall, you would have to take that exam prior to registering. And then once you successfully pass that exam, you're able to register. That's the only prerequisite. Also, all of our health profession programs, including basic nurse assistant, they do require a criminal background check. The BNA program also requires fingerprinting per the state of Illinois and a drug test. But the criminal background check, the drug test are required for all of our health profession programs at ECC. We also, as part of this program, have specific health requirements prior to starting any coursework. The cost of those, which is vary depending on an individual's personal medical insurance. And then you also need to have your CPR, your basic life support CPR for healthcare providers. As far as the tuition for the 7-credit course, it's $925. And then you have your books, your uniform, and your course supplies, which are another approximately $300. So once you go through this course, you successfully complete it. And by successfully completing, that means that you pass this course, Nursing 105, with a C or better. And our C, in terms of the basic nurse assistant training program, as well as all nursing courses, is an 80%. So that might be, I mean, I know U46, you guys are used to your standards-based grading, so not so much with percents, but that 80% is a little bit higher. When people think C, they typically think 70. But here for this particular program, as well as majority of our health profession programs, as well as nursing, it's 80%. So you successfully complete the course with that C or better, and then you're gonna go ahead and receive that basic vocational specialist certificate in the basic nurse assistant training program. At this point, you're then eligible to take what's called the Illinois State Competency Exam for certification. And so the current cost for that exam is $67. We do offer that exam on campus. So a couple times a month, they test for that exam on the ECC campus. Students must have a valid social security number in order to take that exam, and then become listed on the nurse aid registry in the state of Illinois. And then certification is required for employment as a certified nurse assistant. So you'll complete the course, and many of our students, within usually a month, they usually will sit for that certification exam, so then they can start working.
Renee, one question that Mr. Duty just put in the box. What has happened to job demand and everything with the result of the pandemic? Do you see the nursing assistant program even needing more people, less people? What do you think that looks like over the next 2 years?
Yeah, I mean, it's continuing to, I mean, I will say, I did a job search just in our area, just to see like what are the openings in just the last 2 weeks. Just looking at Elgin specifically, not the surrounding areas, there were 61 different job openings for certified nursing assistants. So there continues to be a need, especially in the home health. I mean, there's a variety of options depending on what students are looking for, but home health continues to be a huge need, and so it's still growing. There's still a need, and students will be able to get a job.
Renee, talk a little bit more about home health. I'm assuming if they chose a home health company to work for, that they would need their own transportation. They would go from home to home during the day. They would be doing scheduled visits. Talk a little bit more about that.
Sure. So yes, you're right. So in that case, they would have to have a valid driver's license. They would have to have auto insurance and their own vehicle so that they would be able to go. I have a couple students now, nursing students now, that are employed as certified nursing assistants in home health. They choose that because it's a little bit more flexible for them. So they'll pick what their assignments are. I have one student, it just works well with her kids' schedule and then her school schedule, that she does 2 overnights with a couple in their home. So like where she stays overnight. And so she's available. So it's not that they need much care while they're sleeping, but she's available. So she chooses that because she can, once she gets them to go to bed, she can study, do what she needs to do. And it doesn't really conflict with her kids or with her school schedule. So it just depends on what you're looking for. I mean, obviously you don't have to do overnights. There's day shifts, there are night shifts, there are the overnight. So a lot of flexibility with, what students want to do and what their schedule allows them to do.
And Renee, one other question. Can you give, one of the questions from Ms. Hinkle was compare, the home health, which you've just done, and the flexibility of that to a shift pattern position? Because I'm assuming in most
Sure.
of the assisted living hospitals, it's in a shift schedule. Can you talk about the traditional or the most common shift schedules?
Most of them are 12 hours, so either 7 a.m. to 7 p.m. or the 7 p.m. To 7 a.m. when you're actually in a nursing home facility. Most of them are going to require some weekend commitment, typically every other weekend that you would have to commit to for your shift. But yeah, there are some that have 8-hour shifts, but majority of them are going to be 12-hour shifts at the actual, like your Friendship Village type of setting, or your Victory Center type of setting in Bartlett.
Do you work 3 12s, 36, and get paid for 40? Do you work 3 days a week and then you get days off though, which is really attractive about that, right?
Yeah, so a lot of students have where they have like they work the 12 hours one week, and then the next week they're working 12. Or I'm sorry, 2 shifts, 2 12-hour shifts. So they kind of alternate that way. So yes, that is correct. The 3 12-hour shifts is full-time.
Okay, great, great. Good questions. Let me check the chat box. We're getting a few more. Then I'm going to let you transition into the nursing program. Go back again and mention the facilities that y'all are most often using for clinicals at ECC for the nursing assistant program.
Yeah, if non-COVID times, which I hope to be in fall, we typically are using nursing home, long-term care centers. Friendship Village in Schaumburg is a big one for us. Greenfields in Geneva is a big one for us. There's another one in Elgin. The name's escaping me right now, but that's another facility that we use. But right now, because of COVID, they don't allow the students into nursing homes. And so what we've had to do in the fall semester and this semester, their clinicals are taking place at Advocate Sherman Hospital in Elgin, as well as St. Joe's Hospital in Elgin. And so, as I mentioned, they started this week. So I have one group at Sherman, so they'll go for 6 Tuesdays. So they're basically having 6 8-hour shifts for over the next couple of Tuesdays. And then the other group that's that's going to be starting tomorrow at St. Joe's, they'll go for 6 Thursdays, 8-hour shifts.
I think that's great that you've got the two largest hospitals in the area because they can see so much when they go into an environment that big.
Yes. Oh, and I
And
will
they're
say that
both
those are
well-partnered.
PM, those are PM shifts. So they start at 2:45. So they
And they go
usually,
to, okay,
they finish by around 11. Yeah,
Okay.
with everything. They do get a meal break in there as well.
great, great. Let's transition for a minute. We've talked about nursing assistant. Let's talk a little bit about the associate degree nursing program, because I know a lot of the students, when they were registering for this panel, ask about that. Does the nursing assistant program help you better compete for the nursing program? What is the competition like for the nursing program? If you don't get in the first time that you apply, what do you recommend students do while they wait to possibly try again? Talk about that a little bit.
Sure. So our program at ECC, it doesn't require the basic nurse assistant training program as a prerequisite. Some programs, other programs in the area, some 4-year programs, some other 2-year programs do require that. We do not. But, you know, how would that put me at an advantage if I went through this basic nurse assistant training certificate program? Well, you're getting that hands-on patient care skills. So I think that's really important. You do see that the students that have that certificate, they have that background, they tend to have no issues when they start with clinical. You know, it's just kind of a smooth transition when they get into their clinical experience because they're used to that patient care. Some of our students that do not have that, I mean, they struggle a little bit more. I'm not saying that you have to have this to go to the nursing program, but it also lets you get your feet wet before you commit to this full, I mean, it's a lot to commit to this nursing program. Probably want to make sure that, you know, this is what you want to do, that you want to care for patients. So that's, I think that the CNA program is a great way. It's not a huge commitment of time, but now I can actually get out there and work. And then of course it serves as a way for you to get money. You know, a lot of students that are working part-time, as I mentioned, that one student, you know, she has that flexibility to take those jobs in home health where she can get some money, but she can still then be taking care of her family as well as pursuing our nursing program. So our nursing program is an Associate of Applied Science degree program. So this one's an actual degree program, whereas the BNA is a certificate program. So upon graduation with the nursing program, the student then is eligible to take the NCLEX exam to become a registered nurse. As far as prerequisite courses that are required for admission, so in this case, we actually do have courses that are required for admission. Depending on the student, they could take you 2 to 3 semesters to complete. So it's a basic biology 110, anatomy and physiology 1, psychology 100, and then psychology 218. Those are our prerequisite courses that you must complete before you submit your application. We also do currently have that PSB exam that I mentioned for the basic nurse assistant training program and that Kim mentioned with dental assisting. We also do have that in place currently for the nursing program. The program itself is full-time. It's 70 credits, and then it takes 4 semesters. So that's after you had completed those prereq courses, which I said, again, it could take 2 to 3 semesters. The actual nursing program itself, the courses that are part of that nursing program, it takes 4 semesters. And those are fall and spring. We don't have nursing courses currently that run over the summer. We admit new classes of nursing students every fall. So they start in August, but then also every spring. So in January. So 2 classes per academic year. And then as far as the program, you have your lecture, your discussion component, but then you also have your campus lab time, which is very prominent in the first semester. So the first semester nursing courses, majority of your clinical experiences are going to be on campus. And again, as I mentioned, we have those great facilities at ECC. I mean, it's just like you're working in a in a hospital, in all of the labs. So those are where majority of our first semester nursing students, they have their lab time is on campus. But then we also have off-campus clinical experiences that we weave in throughout the duration of the program. There, we have a variety of sites. So let's see, this semester I have students, yes, at Advocate Sherman, I have them at Amita St. Joe, also have them at St. Alexis Medical Center, Hoffman Estates. They are at Alexian Brothers Rehab Hospital in Elk Grove Village, have them at Delnor Hospital in Geneva. We even go all the way out to Swedish American Hospital in Rockford. We have a couple of groups of students that are out there. I know I have more sites, I'm just missing it, but those are going to be all hospital based clinical. So second semester, third semester, fourth semester that they're going off and doing those. And so those experiences, when they get to that second semester, third semester, fourth semester, that's an 8 to 10 hour shift once a week. So where you, for the full 16-week semester, that you're going out there with your group. So typically you're with a group of 6 or 7 students, and then your instructor at that site. And then they'll separate you depending on that day, what the caseload is on the floor. And then you'll get, your patient load for that particular day. We also have an on-campus simulation center. And so this is where students, again, have that opportunity to practice those skills before they're out working with the actual patients. So we have mannequins that they can cry, they can give birth. So all these situations that the students are put in, they have codes run before they actually, go out into these settings. So we have a variety of clinical as well as lab experiences to support the program.
Perfect. One clarification, because it relates to a question the student just asked. You mentioned the 70 hours of prerequisite courses, and if you'll define prerequisite, I think everybody understands that. Wendy defined that just a minute ago. You have to take those 70 hours before you can apply for the nursing program, or can you apply before you have to take those 70 hours?
So the 70 hours is the actual nursing program itself is a 70-hour degree program.
Okay. Okay.
The prerequisite courses, I'm just doing the math really quick in my head, is 15 credit hours. Like,
yeah, 15 hours. But do they need to take those? Can they leave high school, apply to ECC for nursing before they ever take the first course and get in, or do they have to take the prerequisite first?
You have to take the prerequisite courses first. And actually what I see most of our students, so you have, as I mentioned, those 4 prerequisite courses. Then we have, because you're getting a degree, we also have some gen eds, like some English. We have some humanities course. We also have AMP2 and microbiology. Many students, because I think you mentioned earlier, Nancy, well, what happens if I apply, I don't get in? A lot of students are working then to complete those additional courses as part of the degree, so that when they're in the nursing program, all they're doing are the nursing courses.
Great, thank you. One other question too. I want to back up just for a minute on nursing assistant. Is nursing assistant, with it being a certificate program, can students apply for Pell Grant to take that program, or does that only apply to associate degree programs?
I'm not sure. Wendy or Kim,
Okay.
do you know that one?
Pell Grants can go for any class that is in an accredited college or university.
Okay, and it doesn't matter the length of the certificate program, because it used to matter on how long the length of the certificate program is before it qualifies for Pell.
I believe that the BNA program is too short of a certificate, but if students identify that they're interested in going for the nursing degree, there's some different rules. So
Okay.
it's best, a lot of this discussion I see that's happening in the chat. These are really good questions, and I would encourage all of you, if you're interested in coming to Elgin and investigating any of our programs, to meet with an academic advisor first. And they can kind of walk you through the requirements for any particular program. What are the prerequisites? What order should those prerequisites be done? When do you actually apply to any of these programs? So that's kind of the first stop for anybody coming to the college.
Great. Thank you, Dr. Miller. Renee, another question for you, and I'm going to ask this question because I know it's a hard one and I don't want to discourage anyone in the audience from doing this, but talk about how many students you actually admit in nursing in August and January every year, and how many actually apply.
Sure. So typically non-COVID, I mean, right now I'm struggling with the clinical sites. So, I mean, typically we would admit 60, but because 60 in the fall and 60 in the spring, but it's just been such a challenge. I can't admit someone and then not have a place to put them, as far as the program. So, I'm doing a little bit less right now, probably more like 50. So if I'm looking at the class that just was for August that was just admitted, I think there are about like around 95 qualified applicants for those spots. I will say though, a lot of students do shop around. So, they're not only applying to ECC, they're looking at other places. Some life happens, and even if they got the spot, they decline it because they just can't do it. It's especially challenging, I would say, right now for students. I mean, nursing is not designed to be, online. I mean, yes, we do have obviously our clinical experiences, but a portion of that discussion is online. And so that is a struggle for students. So I think too, enrollment might be more students, are looking for COVID to end and then with the applications. But as long as you met the qualifications, you get put on the waiting list. So if you have those, you had the PSB, you had all the admission requirements, it's not like you would only get denied if you didn't have one of those courses completed. So we put you on a wait list, and we go through the wait list. And like I said, life happens. So I always tell students, like, yes, of course, it's discouraging at first. Like, who doesn't want to get in, right? First try, but let's just see how this plays out. Because things do happen. I do have people that, they didn't get the spot, that they wanted, and then they just continue the next semester working towards getting some of those other classes out of the way. If the student comes back and reapplies and they have completed AMP2 and they've completed microbiology, they get some more points for their application. So sometimes that helps students to get it. Then typically, if they were on the wait list, for one semester, they come back, they typically are in then the next semester.
Great. Thank you so much. I'm going to move us over to our fourth program that we're featuring today, and it is another option for you that is a program that has high employment placement and also does not take a long time to complete. Dr. Miller, could you talk about the phlebotomy program and what a phlebotomist does and that role and what's involved in getting that certification?
Absolutely. Yes. And I'll just start by saying I began my career in healthcare as a medical technologist. So I worked in the immunology laboratory at Lutheran General Hospital in Park Ridge. And that lab is the lab that's super busy right now because they're the ones who are doing all the COVID testing. So I kind of miss that clinical piece, but part of our responsibility was to collect blood specimens, and the the job is called a phlebotomist. And so that's where I'm going to focus. And if you don't mind, can I share some slides?
Absolutely.
All right. I know everybody's been sitting for a while, and it's, you know, it's fun to look at some pictures. All right. Can you see that? Yes, I'm seeing
Yes,
some
you're
head
right.
nods. Okay. Okay. So phlebotomy at ECC, for those of you who have ever had your blood drawn, I don't know, maybe you closed your eyes, but if you did see what was happening, the blood was collected in vials with different color caps, and the different colors represent, there's different chemicals in each one of those tubes. And it's important because that helps preserve the blood. And then certain colors go to certain labs for testing. So just this picture may look a little bit familiar to you. Basically, a phlebotomist collects blood. That picture on the left there is a venipuncture happening. So blood that's collected from a vein is called a venipuncture. And blood that is collected from either a fingertip or, in the case of an infant, from the heel, those are called dermal punctures. And obviously we would only get a drop or two from a dermal puncture. Hope I'm not grossing anybody out at this point. Sorry.
That'll be good.
Okay, so phlebotomists work in a variety of settings. I would say typically they're found in hospitals, and these would be 24 hours a day. We need to have specimens collected. So overnight shift as well as day shift, PM shifts. Clinics are another place where lots of phlebotomists are hired, doctors' offices, blood centers. So blood centers are the places where patients can go in to donate a unit of blood for a transfusion to someone else, or maybe they want to donate blood that they're going to use for themselves later during a surgical procedure. And then diagnostic labs are another place that phlebotomists can work. All right, what makes a great phlebotomist? This, if you're considering phlebotomy, I think these are the things that you want to kind of take into consideration. Compassion. So you have to be able to put patients at ease. I don't know, you know, needles scare a lot of patients. They're terrified. And so the phlebotomist, you know, only has about 5 minutes to really make that patient feel comfortable while the procedure is happening. You know, sometimes we're drawing blood from very small children, you know, and their moms have to help us through this procedure as well. So you have to be someone who's caring and understanding what these patients are going through. You have to be very detail oriented. So phlebotomy is a procedure, you know, it only takes a few minutes, but you need to make sure that you have all your equipment lined up, ready to go. You can't have a needle in a patient's arm and say, uh-oh, I forgot my tubes. I forgot the purple top tube. You have to have it all ready to go. It's all got to be in a particular order. You have to follow a sterile procedure. Very detailed. When you're labeling the tubes, obviously you have to make sure the right patient's name gets on that tube. So we are looking for attention to detail. Hand-eye coordination. You're going to be holding the needle in your dominant hand, and your other hand is going to be stretching the vein so that it doesn't roll in the patient's arm. So you do need to have good dexterity with both hands. And you're also sort of looking at the patient while you're doing this, because you want to make sure that the patient is comfortable during this procedure. And then lastly, good communication skills. So you have to be able to introduce yourself, learn a little bit about that patient, ask them their name, their birth date, tell them a little bit about what you're going to do, make sure that you answered all their questions, thank them. If you are bilingual and can speak to a patient in their language, sometimes that helps put them at ease very quickly. So these are all really good skills that we look for in the students who are interested in our phlebotomy program at ECC. I'm just going to keep rolling along here. You've heard a little bit about the Bureau of Labor Statistics. That's where we go to get our data. So 2019 is the most current data that we can find on that website, and the median pay. So that's kind of the middle pay for people working as phlebotomists was $17.07 per hour, which is pretty good. When you first start a job, you might not be making quite that much until you have a little experience under your belt. But I would say in general, the Chicagoland area, the salaries are pretty good. And this equates to about $35,000 a year, which is not a bad salary for someone who has completed a phlebotomy certificate program, which can be done in a year's time.
So
And
is it,
then
oh, I'm sorry, Wendy, is it 2 semesters or is
it
it
is,
full 12 months?
it is 2 semesters.
Okay, so you really could do it in 9.5 months if you start in August and graduate in May? No?
About 9 months. Yeah.
Okay.
Yeah. I'll kind of explain that. I think coming up on my next slide, but before we get to that, so students who go through the phlebotomy program at ECC are eligible to sit for a certification exam through the American Society of Clinical Pathology, and then they would be eligible to put those credentials after their name if they pass that test. Now, in Illinois, certification is not required. So you will find employers who do not require that you have that credential, but certainly for the employers who do require it, you want to have those letters after your name. And sometimes it does help you earn a little bit higher salary as well if you're certified versus uncertified. And the certification test, it's a computerized test. So you sign up for a time, they're all multiple choice questions, you have a time limit, and as long as you earn the minimum passing score, you become certified. Okay, so this is a picture, kind of represents like what happens in our phlebotomy classes on campus. So as you can see, that is not a real person's arm that's been chopped off. That is a rubber arm, and it's hooked up. Do you see that little bag of red stuff? That's like red Kool-Aid. So, and the Kool-Aid flows through the veins, and the students practice drawing blood from these rubber arms, and the Kool-Aid actually goes into the tubes of blood. So they know whether they've done it successfully or not. And we require students to learn this technique on campus. And once they're confident, then we do have them practice drawing blood on one another. And so students need to perform 10 successful venipunctures on their classmates during that CLT 101 phlebotomy class. Okay. Is it scary? You betcha. But with proper training and proper practice, it is a skill that you can master. It's an art and a skill. Everyone's veins are a little different. Veins are big, veins are skinny, veins are wiggly, veins are deep. So it's all a matter of being able to find the vein. And then for students who want to go on and become certified, they would enroll in that Clinical Lab Tech Practicum 1, which is 100 hours of clinical time that you do out at a hospital or a clinic. And in those 100 hours, you need to do 100 successful venipunctures. So approximately 1 per hour. But most of our students are doing more like 200 successful venipunctures during that time. And if you want to see a little bit more details about this program, I encourage you to go to elgin.edu/phlebotomy. That is your first step, I would say, to get more details. And then if you have other questions, second step would be to meet with an academic advisor.
Perfect.
Right.
Thank you so much, Dr. Miller. I want to switch back for a minute to the dental assisting program. I want to be sure everybody understands before we leave here today how long it takes to complete the program. What can you expect to make in the program, arrange there? And again, as Dr. Miller said, you may not start out at that median point because you got to get some experience, but I want to be sure we cover that. So we're going to kind of go across that for all the professions. So Kim, could you please repeat how long the dental assisting program is? If you're interested, when is the first time you can apply? And what can you expect to make in that position once you exit ECC?
Thank you. Yeah, I made some notes while the other ladies were talking. 3 semesters I talked about earlier, but the third semester, the whole semester is what we call a clinical externship. So you're not sitting in the classroom, you're not doing homework, you're doing hours in contracted dental offices in the Elgin area in the community. And not only a general practice office, but you could be in an orthodontic office helping with braces. You could be in a pediatric office working on children. You could maybe be in an oral surgery office helping them observing and setting up patients for wisdom tooth extractions and extractions. So third semester is clinical externship hours. I forget your question. Median salary, and I don't have it in front of me, but I believe median salary for Illinois is $19 an hour. Now don't quote me on
Okay.
that. I don't have it in front of me, but I'm pretty sure it's about 19. Again, like Dr. Miller said, that's an average between the high ones who've been doing it a long time and the new ones just in the industry, and they kind of do a little bit of average. Again, Chicagoland area is higher. And I did make a couple other notes. We've been talking about that PSB test, and I don't want that to scare students necessarily. It's not a scary test. It's just, we are looking to see your level of education and your reading, writing, math, science levels so that you can be successful in the programs. I believe all 3 of the programs that we've been talking about today have what we call a 12% level of acceptance. You have to score 12% in each of those categories in the PSB to get into the program. Some of the associate degree programs have a higher level. It's more like 25%. And I also wanted to mention, we have what's called an ICAPS program. I know BNA has ICAPS, dental assisting has ICAPS. I think phlebotomy is doing ICAPS now too. And so what ICAPS is a course, a program that works alongside of our health professions programs to help students be more successful. They have a student support person. They have an extra course that they don't have to pay for, but it helps them review, work on their study skills, work on their test taking skills. The ICAPS is free for students to take, and it's a great program to help them be successful in their health professions program. And it also, I believe, offers them some free textbooks to use, the rental textbooks. They have to return them, but they have them to use. So that's something else that some of our health professions programs have to support student success. And then the pandemic changes piece that was mentioned earlier too. Dental assisting was shut down for clinicals for 3 or 4 months in the summer. When COVID hit real hard, all dental offices in the country were closed. Now that they're open, not a lot has changed because we've always worked in the patient's mouth. We've always been in that virus environment. We've always been very careful with infection control, wearing good PPE, and I know everybody knows what that is now. That it didn't ramp up too much more than what we were already doing. Maybe a higher level of mask, maybe some more face shields, but we are back doing clinical rotations, not having any problems finding those for students, and dentistry is dealing very well with COVID. So I hope that answered all those questions.
Kim, if a student if they're graduating in May and they wanted to start the dental assisting program, can they start in the summer or do they need to wait till August?
Our next class is August. We don't have classes in the summer.
Okay.
I shouldn't say we don't have classes in the summer. That clinical extern piece,
That was my question. Can you do the clinical once
you can do clinicals in the summer. So you could start and do August fall semester, do spring second semester, and do summer third semester. So technically in a year you can be done if you start in August. We also start a program in January. And we can take you part-time. We're one of the only programs that you can take a couple classes a semester to get through, you know, if life is an issue, and you know, we can do some part-time options too.
And Kim, do you know what tuition is running for that program?
All in, drug testing, PSB testing, background checking, textbooks, course fees, lab fees, about 8,000, a little over 8,300.
Okay.
But to put that in perspective, if you were to take dental assisting at a private school down the street, down Randall, they're charging 19,000.
Okay.
So we're half of a private institution.
And we also had that question in the box on phlebotomy. So I want to just back up a second on that. Dr. Miller has actually put into the box that it's about $600 plus books and supplies for the phlebotomy program. And it's plus the 100 clinical hours. So there's a lot of, again, want you to understand the different options, what they pay, how long it takes you, that kind of thing. But the beautiful part about all of this, guys, we haven't heard about a program mentioned today that you can't get into at least by August. So that's great. Let me back up to George for a minute. Thank you so much, Kim. George, can you summarize again? You said something about the 52 hours for pharmacy tech. Can you talk about that one more time? The 200, I believe you said $299 for the tuition and $129 for the exam. And then can you tell us what you're seeing in the local area in pay rates on the pharmacy tech position?
Okay, it's the course is 52 hours. It could be done in about 2.5 months, and we offer the course. Right now it's online, so it could be started at any time. As far as the cost, it's
Oh,
$1,299,
sorry.
which includes the books, all materials. Yeah,
Okay,
and then
perfect.
sure, and then to do the exam, if you want to be certified when you're 18 years old, it's $129 is the exam fee. If you want to do the externship, which is 80 hours at a local pharmacy, the costs could be up to about another $250 because it depends if you need a background check. If you already have it, then you wouldn't have to pay it again. So that's why it varies. As far as what someone hourly wages, retail's about $12 to $15 in that range, and the hospitals maybe about 17 an hour in that area, so to speak. And again, the demand is high, and for especially bilingual English Spanish staff.
And I'm assuming, George, that you have to have the 1,299 all at one time when you enroll in the program, or is there any kind of way to spread that out, or do the students need to save their money and have that ready?
For non-credit, we would need it all at the time of registration.
Okay.
I'll say that that's where the scholarship can come in, ECC scholarship. And students, we have on our course description on our website, part of it mentions at the bottom who you can contact for information about scholarship funds for non-credit classes that are career oriented. And then you can do that and find out what the application is and what's available.
Perfect.
Sure.
Thank you so much. Got a question on the age requirement for phlebotomy. Dr. Miller, can you address, is it 18?
I think it is 18.
Okay.
And I see our students able to work part-time and still take most of these programs. Yes, that is certainly the option. And we do have a lot of students who are working and trying to balance school on the side.
Perfect. All right. Got another question. Also, students, Angie has provided you in the chat box all of the information about the financial aid scholarship contact numbers and locations at ECC. Because again, we sort of have the academic side of the house with us today. We all do panels with admissions and that type of thing and financial aid, and that information is available to you. But if you remember, Dr. Miller has mentioned several times, financial aid questions, you need to go to financial aid. And then also the academic advisor can help you make a lot of those decisions. And that comes in right after you're admitted to ECC. They will assign you an academic advisor, and they can work through a lot of those questions for you. Other questions? All right, I am assuming that for fall, Dr. Miller, if students are interested, they can go ahead and apply to ECC now for August, or is that not correct?
Yes, absolutely. Students may apply to ECC at any time. It's an online application. It's free. It just takes a couple minutes. New students to the college will be expected to go through new student orientation. So, which I believe the college is doing virtually now. So just keep that in mind, you know, your timeline. Kim do you have something, Kim?
I just wanted to also tell students if they're interested in a program, most of them offer what's called an information session that's available to them to watch.
Great.
Yes, so there's some steps that you need to follow. Apply to the college, go through an orientation or an information session, make sure you have all the details, you know what is required, and then you would work on enrolling in a particular course. And obviously there's books to purchase. You want to make sure that your schedule fits in with the schedule of when the course is being offered. I would also recommend, for those of you who are interested in dental assisting, be sure to reach out to Kim Plate. So her email is kplate@elgin.edu. If you have particular questions, she is ready and very able to help you through those questions. If you've got questions about nursing, our basic nurse assistant, we're going to send them off to Renee Skrabach. So it's R and then her last name. You can see it spelled out there, skrabacz@elgin.edu. If you have questions about any of the other credit health professions programs at ECC, please send them to my attention. I am wmiller@elgin.edu, and I will make sure your question gets to the right person. So if you have questions about radiography, or if you have questions about physical therapist assistant, or if you have questions about surgical technology or massage therapy, let me know. I will make sure that somebody gets an answer to you as quickly as possible. And then if you've got questions about pharmacy tech, George Phillips is your guy.
I think this is a great question to end on. It's from Mr. Duty, and he says, and anyone can answer this, whoever would like to. Can you share the most rewarding, challenging parts of your field so students can get an understanding of the realities? Anybody want to take that one?
Well, I'll start.
Okay.
Rewarding is the ability to help patients in dentistry. You know, oftentimes they're scared. Phlebotomy, right? They don't want to have their blood drawn, but people are kind of weird about their mouths and their teeth, and it's not a gross place to work. We very rarely have gross mouths. People are pretty, you know, they want nice teeth, but it's very rewarding to help them get through a procedure, help them get their mouth in a beautiful smile established. Sometimes that isn't always something that they start with. Get them over their fears through their procedures. You know, we give injections to cover pain too. I can't tell you how many times I'm holding someone's hand because they're really nervous about it. So it's very rewarding to help the patients through their procedures. Challenges for dental assisting, it can be really busy, and I like that about it. You know, you're balancing the next appointment. Is your room ready? Are your instruments sterile? You know, what's coming up? And it's ever changing, which is another great thing about it. You know, your schedule could be set in the morning and 3 patients canceled, 4 called with toothaches, and now the whole day looks different. And your job is to help get that day to run smoothly, to help the patients, to help the doctor. And it's challenging, but very, very rewarding, and probably some of the funnest part of the job. I think something nice about dental assisting, especially as in comparison to dental hygiene, is that your day is always different. What you're doing is different. Your procedures can be different depending on the office that you're in. You know, a dental hygienist, they get paid a little bit more. It's an associate degree program, but they clean teeth all day. And so know the difference there. So I like dental assisting for all of those reasons.
Wonderful. Thank you, Ms. Plate. That was a great answer. Anyone else want to take that on? You're going to have a hard time beating Ms. Plate when she's got as many years in the industry as she does. Anybody else?
Yes, Ms. Plate is awesome. So I'll tell you just my background. I knew that I wanted to be in healthcare, and you know, there's lots of opportunities out there. So really the best thing to do is to shop around, because each one has a little different niche. And I knew that I wanted to help people, but I didn't want to have a lot of direct patient care. So that's why I chose to pursue a career in the laboratory. So for me, I would prefer to see a specimen and not the person in the bed who's sick. I'm still helping them. You know, I was still able to help the doctor diagnose whatever illness they had. You know, if it was an infection, if it was cancer, if, you know, any number of possible things. I knew that I was helping that patient. And the testing that we do in the laboratory, you know, we identified the bacteria that may be creating an illness, and we also determine what type of antibiotic is going to be best to fight that bacteria. So I knew that I was still helping patients, but I didn't have to have that direct patient care. Whereas we have a lot of careers that are very forward facing with the patients, you know, nursing, physical therapist assistant. Those are radiography. Those are areas that involve a lot of contact with patients. So I encourage all the students on this call today, you know, to kind of think like, what is it that I like about healthcare? Do I like the patients? Do I like the technology? Do I like running instruments, or do I like actual hands-on a patient? These are all questions that you should sort of do some shopping around. Google careers in health and see what interests you. If you know any healthcare professionals, talk to them about, hey, what do you like about your job? What don't you like about your job? Just to narrow it down, because we don't want you, you know, we want you to take like the straightest path to a career if possible. So that's where talking with our academic advisors can kind of help point you in the right direction. And hopefully we've given you some other options today.
Great. Thank you so much.
One more thing, each of the programs at ECC has a website, a web page that gives some descriptions about the careers. And when he was talking about, I think another one where you're not really directly working with patients would be surgical technology. You're helping in the OR, but you're not really, your patients are unconscious. You know, you're not interacting with them directly, but there's lots of different options at ECC. If you know ECC is where you want to look, get on there and look at all the different programs and the web pages and descriptions too.
Great. Thank you.
Yeah, I
Ms.
would encourage to check out a information session that Kim said. So if you go to elgin.edu /visiting campus, all of our programs about once a month, and they're typically start after you guys get out of school for the day. So those information sessions are usually about 3 or later in the afternoon. Just jump on a Zoom and just learn. Like Dr. Miller said, go to a couple different ones, and you can listen to Kim talk about dental, you listen to me talk about nursing, you know, just get onto the different, why not? Just get yourself exposed. And then also just encourage you, when we get off this call, go to elgin.edu, apply. It's free, it's so easy. And that will just start the process for you of connecting you with that academic advisor, and they could really help, you know, gear you in the right direction.
Thank you so much. One other thing I wanted to mention to you too, we do ECC post-secondary panels. But in lieu of that, in April, on April 7th, from 5 to 7 is Experience ECC. Students, that is a wonderful opportunity to learn everything about the campus, everything from student affairs to admissions to financial aid to everything you ever wanted to know, work opportunities on campus. All of that will be covered in that Experience ECC, in addition to what you've heard today about specific academic programs. So I highly encourage you. We will be getting more information. We requested that last night. We ran a admissions panel in Spanish last night, and we did request more information about the April 7th event. So we will be getting that to the high school so that they can get that information out to you. But that would be a great opportunity if you can make yourself available then. And I think we've covered all the questions. What I'd like to do is put a shout out to Mrs. Hinkle and to Mr. Duty for making this possible today. Students, this doesn't happen in every high school. You don't get this kind of what I call red carpet treatment where you get to talk specifically to the instructors. This is not the norm. So Ms. Hinkle, Mr. Duty, thank you for promoting this with your students and having them here today. Oh, and Mrs. Long too. I'm so sorry. Mrs. Amanda Long is on with us too. Todd, did I miss any other teachers?
No, Amanda, Miss Long, and Miss Hankles. Yeah.
Yes.
I'm here.
thank
I
you
don't know why
both.
my name says I'm a student, but thank you so much for presenting.
Yes, and if you have any questions or your students have any questions, if you will get them to us, we will get them to the appropriate person.
Thank you so much.
And so I want to just reiterate again where we need to go for information. If it's pharmacy tech, George is available and he's put his email in the chat if you're interested in that program. If you are interested in nursing assistant or the nursing program, Renee has put her contact information in an email in the chat box. And then Ms. Plate has put her information in for dental assisting. And then Dr. Miller will take any questions you have about phlebotomy, and basically Renee can answer those too. So please feel free to use these resources. They are wonderful resources. And Ms. Hinkle, yes, we are recording this session and we will make this available and post it on the U46 website, but we'll also send it to you directly. Angie, am I forgetting anything else before we hop off?
No, I don't believe so.
Well, panelists, you were outstanding as always, and thank you. And we are just richly blessed in the community to have ECC, and we thank you for everything you do every day.